Welcome to Be Wise, information about cannabis for older adults. Brought to you by Active Aging Canada, a national charity that supports older adults living well and remaining active. Production for this podcast was made possible through a financial contribution from Health Canada's Substance Use and Addictions Program. Now, let's go to the Active Aging Canada studios and join National Executive Director Patty Clark and Ward Maxwell, Director of Marketing and Communications. Today, talking cannabis and the effects on Alzheimer's and mental health.
We've all heard of Alzheimer's, and it is the most common form of dementia. Dementia is the overarching umbrella, and Alzheimer's is a form of dementia. Researchers think that one factor in Alzheimer's is due to the inflammation of neurons in the brain. And because CBD from cannabis has an anti-inflammatory property, they think, and I'm emphasizing think again because the research is still limited, they think it might help to slow down the progress of the disease. Once again, we've got animal studies that have shown some success, but right now there is still no conclusive evidence of this in humans. But cannabis has shown some success in easing agitation and aggression, and that can come with dementia. So there's no question more studies need to be done to confirm this and to identify a therapeutic dose, but there is a lot of promising practices in this area. There is also some very early research studies that have shown very low doses of CBD in healthy people. It may, and I'm emphasizing may, protect the neurons and help maintain their growth in older adults. So although this is promising, there's still a lot more research that needs to be done in this area. And as we said last week, a lot of research is going on in all these areas, and every year there will be more information coming out. Right now, we know some, but there's a lot more that we need to know.
Okay, we're going to end off this whole section about medical conditions by talking about mental health, just the overall concept of mental health. And remember, we're talking here about older adults and their use of cannabis products. So when we age, we continue to change, and that means we must continue to adapt. Now, some older adults have mental health issues such as anxiety or depression, but mental health issues are not necessarily part of normal aging. Now, the evidence is mixed about using cannabis products to treat mental health issues. Some studies have shown promise, but we need more and larger studies on the effects of cannabis on older people to really be able to predict how it affects mental health and whether or not it's useful in treating and helping people be healthy. Studies have shown that cannabis can heighten anxiety in people who have certain types of anxiety, such as public speaking and social anxiety. So obviously, cannabis products are not recommended for people who suffer from these problems. Health professionals do not recommend using cannabis products to treat depression. Depression is a risk factor that may cause problem cannabis use. But we'll address that in our next podcast when we start telling you about side effects of cannabis and risks. Until then, it's been great talking with you. Thanks, Patty.
Thanks, Ward. Talk to you next week.
Well, that's all the time we have for today. For more information, go to activeagingcanada.ca, where you can order a copy of our Be Wise booklet. It's available in 17 languages and is free. The views expressed in this podcast do not necessarily represent the views of Health Canada's Substance Use and Addictions Program. Join us for our next podcast, and until then, remember to be active, be healthy, and be wise.